Hello, everyone. Heather Holmes here with KTV Fox 2 News in the San Francisco Bay Area. And joining me today is Dr. Tom McCoy. He is with Pharmatech here in California, based in San Diego. And he's going to be talking with us about the new antibody test that they've developed. Tom, thank you so much for being here.
Thank you very much, Heather.
Let's talk a little bit about how you were able to develop this test.
The company that I work for is Pharmatech. We've been around for over 25 years producing lateral flow technology. And we've adapted this to drug tests, pregnancy tests, and a variety of other biological tests. So it was easy to adapt to the COVID-19 antibody test since our technology and manufacturing was already in place to produce similar types of tests.
So how did you, in fact, pivot?
We were able to quickly, in the end of February, beginning of March, obtain some antibodies from China starting the process, developing antibodies. So we did get positive blood from overseas. We developed the antibodies with our partners, and we're able to quickly start manufacturing devices here in San Diego.
And tell me how the test works.
The test is designed to detect whether you have developed antibodies to COVID-19. So if you've been exposed to it and your body has reacted to that, like a typical severe flu, your body produces antibodies to fight it off. Our test detects the presence or absence of those antibodies.
So is this a test that I would need to go to a medical facility to have done?
Yeah, there's two applications for this. One is it has to be a medical professional, which is normally a physician. And the second thing is a licensed laboratory can perform these tests.
Okay, and what is the test? Walk me through how the tests work. Are you taking my blood? Are you taking a nasal swab? How does it work?
Yeah, this is a blood-based test. So whether it's a finger prick or IV blood that's been drawn, about a drop of blood is placed on a membrane. The blood is absorbed, and then about 1 to 2 mils of a buffer solution is added to the blood, and it elutes up the membrane and determines whether you have the presence of IgG or IgM to COVID-19.
And how quickly would I get the results?
Takes about 8 to 10 minutes at the most.
Oh, wow. Okay. And where again are these being manufactured, and how many tests are you manufacturing at this point?
We manufacture these in San Diego in our facility here. We're also a licensed clinical laboratory and a federally licensed forensic laboratory as well, and California licensed, of course. We manufacture basically as many as we possibly can in a 24-hour period, about 6 to 7 days a week.
And how many customers do you have? And is it cities and counties who are purchasing them, or is it individuals?
We have laboratories that are purchasing our product. We have physicians with the appropriate license purchasing them, and we do have a lot of states and territories and counties that are purchasing them for their health departments.
And are these tests being administered mostly to essential workers?
Yeah, the key and benefit to this product is not to determine who needs to go to the hospital. This is a post exposure test that allows an employer, for example, to send people back to work because they can either determine A, you've never been exposed to the virus, so you can go back to work and practice safety precautions, continue to practice safety precautions, or B, you've been exposed to it and you're producing antibodies to it. So you're safe to go back to work either way.
Obviously, you've heard of a lot of concerns regarding these tests. How do you answer the questions about its effectiveness?
Because I think you need to understand what the purpose of the test is. I think when this test first came out, it was understood that it's a tool to diagnose whether someone had or had not, is infected currently and needs to go seek medical attention. This test has its primary purpose in post-infection. So have you ever been exposed to COVID-19, yes or no? And if you have, are you producing antibodies to it? So that's really where the key important component where this test comes into to helping the general public.
And what about its accuracy?
Yeah, we've done many tests, both overseas and domestically with a lot of medical partners. And the correlation between PCR technology, which is what the CDC uses, and our test is about 98%.
And how many, you mentioned you've done a number of tests. Can you give me a ballpark on the number of tests
Well,
that have been done?
because a lot of them are confidential and report them to government, I can't release the number of tests we perform, but it's significant.
And then is this something that is in fact FDA approved?
The FDA has a waiver in place for these products while they're actually reviewing them individually.
And how does it feel, Tom, to be a part of something so important right now?
I think it is a company. It's something that we're very proud of. We have a lot of employees here that are doing above and beyond duty, not only working 24 hours a day, 7 days a week, but we have employees going out and risking themselves to help put safety sensitive employees back to work for certain agencies. And that's beyond what we normally ask of our employees.
And Tom, what is the ultimate hope here for you?
The ultimate goal is to, of course, have a vaccine or medication that prevents anybody from getting ill from this terrible disease. But right now, we want to make sure that people who have either never been exposed and continue to practice the precautions by our government, or those that have been exposed are safe to go back to work. That is the most important drive right now.
And for those who may watch this and wonder, okay, how can I get the test? What do you tell them?
They need to seek either a physician or a laboratory that a physician will order the test for them to go. They can also, there are some employers who are contracting with physicians and hospitals to have their entire workforces be tested so they can go back to work. And of course, counties and cities and governments that has individuals in safety sensitive positions, they're trying to get their employees back to work as soon as possible.
I know that you're a little hesitant to talk numbers, but I'm guessing that you're looking to ramp up the number of test kits that are produced. Can you just give me an idea, though, how many are being manufactured and then being sent out to the various agencies and individuals?
Yeah, I'll ballpark it for you. We're producing hundreds of thousands a week.
Tom, is there anything else that you would like to add as we continue to follow the developments with this antibody test?
Yeah, I think it's important to understand that this test is not the definitive answer to the disease, but it's a tool that individuals, companies, government agencies can use to help bring people back to work. And that's really the bottom line, is to getting the economy back operational again. And this is just one of many tools to help get that accomplished as soon as possible.
And again, you feel like it has a high enough accuracy rate to provide that sort of sense of relief and confidence to those agencies.
That's correct. Anybody who's been exposed to it or is negative is negative, and we do have protocols that we've published about how to put a large group of people or employees back to work, and it also includes retesting individuals over time, because just because you're not infected today doesn't mean you're not going to be infected in 2 weeks. So we have a great protocol that we provide to our physicians and our employers that are wanting to put their workforce, back to work.
All right. Dr. O'Coin, thank you so much. Really appreciate it.
Thank you, Heather. Have a great day.
Thank you.